Welcome to Eating Enlightenment, the show that explores individual transformation stories around food, eating, body, mind, and healing. In particular, giving exploration towards the cognitive, the thoughts, the mental paradigms, the ability to reconnect with your body, the tools and strategies that work, and just having some fun along the way. I'm Jared, and long story short, I struggled with food. I was a wrestler. I became freaking miserable. I became a monk because I was so miserable. And up in the mountains, got some meditation goodness. And now I'm all about spreading the mindful vibe. And my role in this podcast is to simply explore, ask great questions, and stay in the present moment with my guest, Dr. Jen, who has an incredible passion for swimming. And this is a fascinating conversation, not only about swimming, but also about holistic lifestyles. She gives her tips on how she has been adjusting to life on the road and how you can apply these tips to your life. But also the heart of this discussion is about how, if you're movement impaired, if your joints are hurting, if you have arthritis, if running on the treadmill is just not your thing, then aquatic fitness can be life-changing. It can be transformational. It is so good for pretty much every type of body. Very much a health at every size approach right here. I love this conversation. And most importantly, Dr. Jen is going to be in the Bay Area doing her own swim workshops coming up in this month of May. And so you can get more information in the podcast near the end. And without further ado, let's hop in and talk with Dr. Jen. So, Dr. Jen, you're traveling abroad, or not abroad, but you're traveling, and you've started this new lifestyle that revolves around traveling. Can you tell us a little bit more about this?
Yeah. So, up until the pandemic, my practice was focused in the Bay Area, and I did a concierge practice. I'd go to people's homes and work with them at their homes, their gyms. But then I like to expand out, and we did a lot of hiking. I took people out surfing, wherever it is that they needed to get a little more active. I was there to help them. So since the pandemic, most of my practice has transitioned to online, and my husband's work as well. So we kind of restructured our lives a little bit, and now I find myself traveling around California and then later to the rest of the country in a fifth wheel trailer. And so right now we're on our California tour, and as we're traveling around California, we're stopping in all these little towns that I have never been to before. It's really exciting. And then in each stop, we're finding opportunities for healthy lifestyle habits and exercise programs that can kind of be done anywhere, especially for communities that are a little underserved and don't have a lot of gyms or a lot of PT clinics to go to. I am producing content for how people can stay healthy without using equipment, things that they can just use either around their house or in their environment. And then a few stops along the way, I'm starting to get more and more into connecting with those communities and offering events. So now that things are kind of loosening up a little bit with the pandemic, I am offering some aquatic fitness
Yeah, I
classes,
was
which
just gonna
is one of
say.
my biggest passions. I'm doing outdoor, park kind of events for training people, and working one-on-one as well in safe environments, mostly outdoors right now. But soon, hopefully, I'll be able to go back into people's homes as things kind of get better under control.
Yeah, no, and we'll talk about swimming later and some of your how that's going and how that's unique and everything. I think that's very interesting. In terms of moving, because we're going to talk about lifestyle tips and holistic medicine and so forth. I imagine, I went downstairs earlier today and I
I have my cup of coffee ready. I have my sleeping routine. Like my bed is all set up, the lights and everything. And I imagine it would be much more difficult to practice holistic lifestyle things when you're so used to living in your home, but then you're on the road, you're switching locations. There's like different food that you're trying to buy and everything. Like, how are you adjusting to that?
It has been an adjustment. So prior to hitting the road, um, my husband and I lived. We didn't own the property, but we were very fortunate to live in this beautiful cabin in the Santa Cruz Mountains up in the redwoods, and it was on a farm. And we were allowed to use the garden as much as we wanted. So we were growing our own organic food most of the time.
Mm,
We had all these amazing like hiking trails to go hit every day through the mountains. The beaches were close by, so we had all these opportunities. And so now in a trailer, life is really contracted down quite a
yeah.
bit. Um, so as far as the food goes, I really miss going out to the garden and picking my dinner and my lunch every day. But we really have enjoyed going to, as we travel around, seeking out the farmers markets.
Mm,
So I'm getting my organic produce locally sourced, locally raised. I'm supporting small businesses within all these communities we're going
mm,
around to. So not just our produce, but also meats and coffee and tea and like kind of all of our staples that we need for nutrition. Um, and we've always been in the habit of making our own food most of the time. So
mm.
going out to a restaurant is kind of an indulgence. In the past year, it's really been an indulgence if we eat out. So we're really kind of controlling the foods. I know what's in the food. I know there are no preservatives, no added chemicals. I control the salt content and all this. It's exactly the flavors that we like without anything extra in it, and have been able to maintain a mostly plant-based diet while on the road. So as far as the nutrition goes, that has been um, a little bit of an adjustment, but I feel like we're making do
Okay, I got you.
okay.
Okay.
Um,
I got a question.
sleep.
So
Oh, yes, go
let's
ahead.
say, because we're gonna talk about holistic medicine. So what are like the big five or the big areas that you focus on? And then let's compare how you're switch like we just covered food for
Yeah.
traveling in a van. So let's go through like the big categories and then how you're adapting to them on the road.
Oh, great,
Right?
great. Okay.
Such a good
So we did
idea.
food.
We
We
did
did
food. What's the
nutrition.
next? Yeah. Like sleep,
Um,
right? Sleep's gotta be up there.
sleep is up there,
Maybe
and
maybe not though. Maybe you have a different take on
no, I
it. Okay, okay.
absolutely. If you're not sleeping well, your body is not functioning well. So
Mm,
it's a really, really high priority. When I'm working with my patients, making sure that they're getting adequate sleep. If they have disturbed sleep, we kind of work through that and see how we can get them on a set schedule so they're getting good quality sleep. Their immune system is working properly. If you're not sleeping well, then you're more inclined to get, dementia, Alzheimer's in older age, or many other chronic conditions. So it's super duper important. So while on the road now, or I should go back to living in the cabin. So because we were in such a like a private area before, we didn't have any curtains in the bedroom. So there
mm,
was no light blockage. So we were really in sync with the sunrise and the sunset, and like,
mm.
the sun would kind of be our trigger for starting the day. In our trailer, it feels a little bit like this little cave of a space where we sleep. It gets super dark,
Uh,
which has really helped the quality of sleep
mm,
a lot. The biggest challenge has been the with because we're still transitioning lifestyles. It's been about 6 months that we've been doing this, and we're learning as we go. So with that comes a lot of stress and anxiety, and
mm.
like, oh my gosh, there's like a new problem to deal with. And so as there are stressors mounting up, that seems to be the biggest thing that is disrupting the sleep, is making sure that we can do some self-care and manage anxiety, manage our stressors, so that when it's time to go to bed at night, we're in our dark, quiet environment, and we can just, relax and get those quality, 7 to 9 hours that we need.
Mhm.
It's more like 7 most of the time. Um, so that's been actually not too hard of a transition, and my husband had said that, living in this darker bedroom has really improved the quality of sleep. Most nights it doesn't make a big deal, but like on a full moon night, if you don't have curtains, it gets
Mm,
kind of bright. and,
yeah,
and so that was one of the things that might trigger us to kind of stir in the middle of the night before, so
I
we're
see.
not dealing with that anymore. So next I would say is self-care.
Yeah.
um, so managing, like I said, we've got a little anxiety. We've never done this before. Every day is a new adventure. So I have been doing a little bit more journaling. Is something that has always been a kind of struggle for me to get into the rhythm of, but it is so helpful.
Mm,
Um, I
mm.
often
I mean, I'm
indulge
the
in
journaling guy.
mindfulness.
I'm the journaling
I
guy.
know, I know. And listening to
You
your
don't have to tell
podcast and
me.
reading through your website, like, I'm like, yes, I really need to do a lot more journaling. But I'm working on it. I'm working on it.
Yeah, yeah.
Mindfulness has been something I do way more now. So just like taking quiet moments to observe where I am, the beauty of the spaces I am. Where we're usually in, wilderness areas. We try to get away from people when we're camping, and so we kind of have the landscape to ourselves. And so just the other day, sitting by this little creek in this beautiful open meadow, and just watching the water go by and breathing the fresh air, and taking a moment just to kind of center into the present
Mm,
and let those other anxieties and everything else kind of step aside for a little while. I do a lot more stargazing than I ever had before,
oh, nice.
and so all of
Mm,
those are very helpful. Um, and of course, exercise is
mm,
one of the biggest things that you can do for maintaining mental health
mm,
and managing depression and anxiety. So we are hiking all the time. Um, I am not a morning person, but I'm trying to adjust to doing some more exercise early in the day to make sure I get that done.
mm.
On occasion, we do some, big full day hikes. Have been able to meet up, with a person or two in a nice distance, safe way to do some outdoor activities. Um, so maintaining the exercise, some mindfulness, some
Got you.
journaling,
Yeah,
all of that for the self care.
yeah.
Um,
Sleep, food,
let's
and
see,
yeah, no, that sounds about right. I mean, that's how
yeah,
I love hearing from a doctor. Like this is probably the best approach to medicine. Like this holistic sort of preventative. Just be like, don't wait till, do not get no sleep, get no exercise, do not do these things, do not take care of
yeah.
yourself, and then wait so long, and then it's too late.
That I think really gets to the heart of what's my biggest complaint with the modern medical system. And
Mm,
it is great for so many things, but what we have is a sick care system.
mm,
Is that people wait for a problem to arise, and then they go to the doctor, and the doctor will give them medicines or prescribe therapies or whatever as a treatment. Whereas if we were a culture of well care,
mm,
and if we
mm,
really prioritize prevention and get people into their healthy lifestyle, correcting movement, correcting nutrition, correcting sleep, hydration. For me, footwear is a big deal, and managing gravity forces
mm,
throughout your day, posture, all of these things. If we fix that when somebody's young, teens, 20s, then they'll never get to the point where you're just like slowly chipping away at your health. Because really, for many conditions, it's a decade or more of bad habits before it actually catches up with you.
yeah,
And if we can kind of
exactly.
nip that in the bud early, then we can cut down on diabetes, Alzheimer's, heart disease, pulmonary disease, all of the things that prior to COVID were the top causes of mortality in this country,
Hmm.
are mostly lifestyle related.
Yeah.
Um,
Yeah.
so I'm really passionate about trying to speak to the young people. A lot of
Yeah.
my current clients are older and they're like, man, if I had just known this stuff
Uh,
20 or 30 years ago, I'd be
uh-huh.
in so much better shape.
I feel it.
So
So here's a controversial question. Well, at least something that's on my mind because I feel I'm healthy. I'm doing the self care. I'm doing the sleep. And so I'm thinking like I don't know. Maybe this is egocentric of me, but I'm like, what do I need health insurance?
what do you need?
Do I need health insurance? Because I feel like I'm very low risk,
Oh,
right? I mean, that's kind of been on my mind. I'm like, and what if I'm not at risk? What if I'm doing all the prevention? Like, then I'm like, well, the odds of me getting sick are less. You know what I
yeah.
mean? And I don't know. I'm not saying I know that's probably as a doctor, you don't want to say yes or
Well,
no to that, but it's just on my mind. I don't know. It's just any thoughts?
you have given me a controversial question, and so I'm going to try to be very
Go for
cautious
it.
with my answer.
No, no,
But
just go
I
for it.
do have to say, my practice, I do not deal with insurance
Mm,
for a reason. Um, I give my patients super bills that then they can submit for reimbursement from their
mhm.
insurance companies. But I feel like the way the system is set up now is somewhere between broken and not serving us well.
Yeah,
Um, so
yeah,
with insurance companies, I'm highly opposed to a lot of the time it's somebody in a cubicle, or now more it's just an algorithm that is
yeah.
calculating like, am I gonna should this person be approved? How much
Mhm,
should this person be approved for?
mhm,
And a lot of it isn't anybody who's ever had any healthcare training is making these decisions
mhm.
about your benefits. Um, and as a doctor, as a doctor of physical therapy, I I find that when I worked for other clinics in the past, they would show me, well, this code gets reimbursed this much, and this code gets
Yeah, yeah,
reimbursed this much. So we want you to do more of this and less of
yeah, yeah.
that, and
Uh-huh.
I that shouldn't be any part of my clinical decision making.
Mhm,
So that's a big reason of why I stepped out of the
mm,
insurance game so that I can spend as much time with the people as I want. I
mhm,
can do the treatments with my patients that I feel are the best for them. And I'm not biased by all these other like financial factors.
yeah, yeah,
I
yeah.
charge a flat rate.
There you
So if
go.
we go over time because I
Mm.
feel like you need more time, then I'm not going to charge you more for it. Now, getting back to your question on does a young, healthy person need insurance? Um, I wish that there were more affordable options. And I've certainly been through this myself, looking for insurance coverage for myself. Of
Obamacare
man, I
is
this is
covered California is good. I mean, it's
covered
cheap.
California
It's
does
cheap,
a
like
lot,
yeah,
but it's still for a lot of people. If you
yeah.
just make a little bit over the range to get whatever subsidy amount, it can be very expensive,
Ah,
and to get a good quality plan is can be
mm,
very expensive.
sure.
So trying to find a plan that works for you, that is
Mm,
affordable, is a challenge, I think, everywhere.
yeah.
And that I'm hopeful that our system will continue to make changes in the future. But let's say that something catastrophic happens.
Yeah,
If you're in a car accident, if you get in a well, I was going to say work accident, but workers' comp is a kind of its own system. Um, if you get a chronic condition
yeah,
diagnosis like cancer,
yeah,
certainly if
right.
you wanted to get treatment in our modern medical system um, out of pocket,
Yeah, that'd be
you
nice.
are probably,
I
the
know.
costs are just astronomical.
Yeah.
So therefore, it's a gamble,
The
right?
gamble,
And
right?
you're going to be spending a lot of money for a lot of years if you're healthy, and knock on wood, hopefully
I
nothing ever
know, right?
happens to
I
you.
know, I know, I know. Yeah.
But if it
I
does,
know. It's such a difficult one. I think every person needs to like feel into that for themselves and what their risk
yeah,
tolerance is. I think that's
yeah.
kind of the ultimate solution. But I do have covered California just if you're listening.
Oh, good, good.
But it's
I do, I do
but
too.
I keep thinking like I'm like I don't like the system. I'm a healthy guy. Like it's on the back of my mind. So anyways, I hear what you're saying, and I do hear like if something bad happens, it's terrible. So it's like, I mean, that's the whole point of
Hmm.
insurance, right? But then the odds
Hmm.
are like, I'm a young, healthy guy. So, anyways, so
Yeah.
I love hearing about you really like to serve the community, you like to spend time with people, and now one of your passions is like going to communities and doing swimming lessons, and not swimming you can provide more information on this, but like, so what do you
Yeah.
do? What do you do, and how'd you get into it? Because this is a kind of a unique thing I haven't heard
Oh, right.
of.
So, I am a specialist in aquatic physical therapy. So I'm certified by the American Physical Therapy Association, had some extra training, and I got into aquatics because I myself live with chronic pain and I have arthritis in many joints of my body. And so when I was working in a typical clinic situation, let's say I'm helping somebody to walk and I am like supporting their weight and I'm moving their limbs forward for them, and it's very labor intensive, and by the end of the day I was just like, oh, this is a lot, and I'm beating up my own body. So
Hmm,
I had heard about aquatics, working with people with disabilities in the past, and how you could put somebody who, for instance, with cerebral palsy, who might be paralyzed, and put them in the pool. When you unload gravity from them, they can, not everybody, but a lot of people can just move more freely, and you can get a lot more
hmm,
um, range of motion when you don't have all this gravity weighing you
interesting.
down. So when I went into the pool, the example of helping somebody walk, first day was like, oh
Hmm,
man, this is it for me forever. I love it
wow.
because I can hold them and keep them safe, and I can move their limbs, but I'm not holding the weight of their body up.
Sure.
And there are many, many benefits to exercising in the water. Um, so one is that you don't have as much gravity on you. I work in heated pools. The pool that was my home base prior to the pandemic was 92 degrees, which sounds like it's a lot, but it was really like stepping into a warm bath.
Mm,
So it was super comfortable. And that helps to relax the muscles and loosen things up. The pressure of the water on
hmm,
the body helps out with circulation a lot. And for instance, if you're in the deep water and you're submerged up to your neck, doing exercise, you tend to have 35% greater cardiac output
hmm,
than you would if you're doing the same exercise on land. So the
hmm,
movement feels a lot easier, to the body. I can push super hard in the water, and I'm not going to be beat red in the face and huffing and puffing and pouring sweat like I do on land, but I'm getting the exact same level of benefits as I
hmm.
do on land.
Interesting.
So for aquatic therapy, it's not swimming. I very rarely ever have somebody get their head in the water. Um, Usually we're in a vertical position. That's for most of mine. Sometimes there are a lot of really wonderful techniques where people are floating at the surface of the water, and I can do a massage with them and kind of access,
Hmm,
their all of their back, and get the water to kind of push against them and
hmm,
move their body for them. Watsu is an example of a water massage.
hmm.
So there are all these techniques that are available, but as a person with arthritis, I found it to be life changing for me.
Yeah. Tell me
So
more
I
about
would,
that. Like, so
yeah.
you were helping people up on land, you were supporting people, taking all their weight and all that, and you had
Hmm.
arthritis. And so did you just hop in the local swimming pool and start doing some laps, or like what did you know, like what worked for you?
Well, for me, it was the biggest cardio. I love doing deep water exercise for cardio. I mentioned that cardiac output. You know, your heart is just working so much more efficiently because of that water pressure against the body. But also just running laps. So I'm not really a swimmer. I can swim, but I won't call myself a swimmer. Um, I would walk and run laps, and the
Huh.
faster you move through the water, the more it pushes against you. So it's like this whole body resistance training. And when I would try to run on land in the past, I'd been trying for years and
Hmm.
years, and I would like kind of warm up to it, and I had apps and I had these programs, and I'm a PT. I know what to look for and how to train the body. So I would get going and I'd feel really good, and by every single time by about week 2, my knees would just say, "We are done. I am not doing any more of this." And I never really got past like 2 to 3 weeks of running on land. Once I started training in the water, running laps at
Hmm.
about like chest depth in the water,
Hmm.
um, I had this resistance against me. I was unweighted. I could run full throttle as
Huh.
hard as I could, and I could do that for like an hour.
Awesome.
And it was amazing. And the best part of it was then, after I had been training in the water for a while, I tried it again on land, and it was like I was running on air. It
Oh.
was
Huh.
because I'd been pushing
Yeah.
so hard against that water, and I built up my endurance and built up my strength in the water. By the time I added those gravity forces to myself on land, um,
Wow.
right out of the gate, I was able to do, a mile, and I was doing okay, which was huge for me. I was never able to run a mile before.
Mm.
And then this past year, during the pandemic, after I'd been training for years in the pool, I actually did my first 5K, a virtual 5K,
Oh,
running
nice.
through those Santa Cruz mountains.
Oh my
So up
gosh.
and down hills and like pushing hard,
Oh
and
man.
that was something that I really didn't think that my body was ever going to allow me to do. And
Wow.
I attribute all of that to my endurance training in the pool.
That's incredible. Oh man, that's amazing. And this is just like with cold water too? Was it, did you have a heated pool?
Well, the pool that I trained in most of the time prior to everything shutting down was delightfully warm.
Okay.
I did have access to a pool on occasion,
It seems tough
which
if it's
was
cold, you know? I don't know, but I guess people do exercise for swimming, but you think like the cold would be that a little barrier? I don't know.
yeah.
Like for me that's always
If
been a barrier, but not to diminish the enthusiasm. I'm sure if anyone is struggling with arthritis or joint pain, like just the ability to hear your story and say, "Hey, like I can do that too." I'm sure anyone will jump in like a cold pool. But I was just curious, like where maybe not though.
if you're gonna be in the cold pool, I mean, there's a temperature range that's considered reasonable for aquatic therapy. So if you're going to be in a
Because you
cold
need to
pool,
relax.
you're like,
Yeah, yeah,
yeah, you're like moving and shaking the whole time. You got to be vigorous to keep
yeah.
warm. If you're in a heated pool, I can
Interesting,
have you just like standing still and working on balance and
interesting.
doing deep breaths, and you're not going to get the shivers, and your
I see,
body's relaxed.
I
So
see,
it does. The temperature does make a big
I
difference.
see. Yeah,
But
there's a
I
difference between like swimming and aquatic stuff for exercise, we'll say, versus for therapy.
Absolutely,
Okay,
yeah,
I see,
yeah,
I
big
see.
difference. So it's how you
Can
use
you
the
do
water.
self therapy on your own? I guess you can. The way you were describing it, I guess, kind of sounded self therapeutic, right? Go just even walking or running in the pool. I guess someone can do that in either temperature of a pool, but there's other aspects of aquatics therapy where you're on the back or on your back getting like maybe your
Mhm.
neck worked on or something. It's hard for me to like visualize what that looks like. Like I can imagine the easiest thing is just someone's lying, maybe they have like a floaty or something, and they're lying on their back and like they're the person's like working on their neck.
Mhm.
Um, but any other position, I cannot imagine. Like, I mean, sometimes how can someone lay face down, right? I mean, in the water,
Well,
they're gonna drown, right? I mean, I don't know. Is it like how would you what
some
does aquatic therapy look like besides the obvious laying on your back and getting a head massage?
Yeah, yeah. Well, some people do face down work if you're using like a snorkel or something. You
Oh,
can do that.
really? Interesting.
I
Okay.
I
Okay.
prefer not.
Okay.
But it really depends on the patient's needs and what they need to work on. So let's think of so for aquatic therapy, because it's just so good for like everybody, really. I can
I
take
love it.
I can take a frail elderly person who's like falling down every week, and I can take an Olympic athlete who
Mm,
is at the peak of their physical condition, and I can put them through a water workout,
mm,
and both of them are going to walk away from that going like, oh man, that was good, I feel
interesting.
totally worked out.
Interesting.
um, so it depends
Hmm.
on a lot of factors on how you can how hard you're pushing the body, pushing against the water, the speed of the water.
Mm,
People with chronic pain, the water just unweighting the joints. If you move
mm,
slowly, the water supports you. And so if I'm moving like really slow motion, my limbs are supported and I can like get a relaxed stretch in a joint that might have been really painful for a long time. But if I start moving quickly,
mm.
that water's pushing back. So now I'm doing strengthening, I'm doing core training, I'm working on advanced balance maneuvers that I would never have somebody do on land. Like I wouldn't take that frail elderly person who's falling
Mm.
and have them do stuff where like they're closing their eyes and turning their head and reaching around with their eyes closed. But in the water, we can do all those skills because
Yeah.
if they fall, their hair gets wet, and that's the worst part. No one's going to
Uh-huh.
get hurt.
Uh-huh.
um
I remember my dad injured his shoulder and he went to the physical therapist and he had to do these different exercises. And the way you were moving your hands, if you're listening to the podcast, we're also doing a video and there'll be a link you can watch it. But Jen was moving her arms like out like wings, and I could see like doing that in the pool, especially if like you have a sore shoulder or something like that, how the water pressure
Mhm.
would could just do so much for like a sore joint.
Yeah,
I
yeah.
like the idea of
Another
balancing too, because people get scared of balancing. I mean,
oh,
like standing on one leg if you're gonna fall. I
yeah.
I could see
I
that
mean,
being really
I'd
helpful for.
have
Hmm.
people who were recovering from a surgery, um, balancing on their tiptoes and then hopping and doing like single leg jumps as far as they can go in the water, super gentle, gonna be okay. On land, if you mess that up, you might have to spend a
Yeah,
week recovering,
yeah.
so I can do stuff with people in the water that I would be just personally too conservative of a clinician to have them do on land. But it's just so much safer.
Mhm.
Day one, chronic back pain in the clinic. On land, I'm managing symptoms. We might be doing stimulation or ultrasound. I might be doing massage work just to try to get those symptoms under control. Day one in the water, we are in the deep end running
Mm.
and doing cardio day one because it's just they're able to do it.
Yeah.
So it's a world of difference. I want everybody to try aquatic fitness.
Yeah, and so you're
Um,
traveling, like, I mean, so part of your it's kind of cool that you're combining, like, your passion for, the van and traveling and going to different communities, and you're also trying to, like, serve other people and teach other people, aquatic therapy as you travel, right?
mhm.
That's kinda, like, part of your vision where I don't know, you find, like, places and teach people aquatic therapy in a nutshell.
Yeah. Well, not just the aquatics. I also do a lot of land-based classes, and I've got online classes in case people like what I'm throwing down and they want to keep at it. Um, so I'm really right now. Actually, the fitness part of my practice is probably about half of my practice right now, and then the rest is kind of clinical physical therapy.
Mm,
Um, so I'm really passionate about making sure that people know whatever state of health you're in, where you are right now today, there's a way for you to be physically active and to take care of your body.
I love that message. I love it.
I
I
I've
mean,
worked with a lot of
yeah, like we both know we kind of have know Cielo House in passing, and I know Cielo House
mhm,
embraces like a health at every size perspective, and that's a core tenet of health at every size, right? Like you you can be. I think the message of health at every size, and on the health side of things, there's a social justice part to it, but one of the big messages I think is you can be healthier at any size. Like just because you're big or small or fit or unfit or fatigued or energized, you can always be a little bit more healthier. Like there's nothing that ever stops you. You don't reach a point where you are hopeless ever. And I really
mhm,
find the message of aquatic therapy useful because I mean sometimes people are um, experiencing really a lot of roadblocks in their health journey. Let's say if they're in a bigger
mhm.
body, right? Like their knees might hurt just like going on a walk or something like that. And even I imagine too, I know people can definitely feel um, self-conscious. And so I imagine some of those issues might come up in aquatic therapy, but once you're in the water, like you're not visible. I don't know. So it might but I don't know, putting on a swimsuit could also be,
Yeah.
self-conscious as well too, so maybe it kinda evens out. But I certainly think that in terms of, like, joint fatigue or, like, the pain in the joints, like, that just makes so much more sense, especially if someone is blocked from other, like, health avenues, like hiking or something like that.
Absolutely. I've worked with a lot of people who were trying to get their health under control in relation to obesity or diabetes, being overweight. Um, and it's for all people, I think the mental roadblock that they put up for themselves
Yeah.
first is that bathing suit thing.
Yeah, yeah,
and
for
um,
sure.
you do not have to wear a bathing suit. I have plenty of people who wear like shorts and t-shirts just
Oh,
over a
yeah, oh,
white
I see.
shirt,
Yeah, yeah, yeah.
Um, so you can be modest, you can be covered. I always wear like shorts or even long leggings in the pool. Um, but I'm thinking of this one client in particular who I was working with, who we tried for a long time on land. He was I think he was about like 330 pounds, wasn't getting a lot of movement in. He had poor balance because he hadn't been moving for very much. And it was just painful. We
Yeah,
do like, we do a workout, a gentle workout together on land, and then it would take him 2 days to recover.
yeah,
And so we went about that for a little while, and eventually he finally said like,
yeah,
okay, I'll go to the pool as long as I can wear a
yeah,
shirt and
yeah, yeah.
shorts. I don't do the bathing suit thing. I'll go to the pool. And he blossomed.
Oh,
um,
yay.
just getting in the pool, he felt so much more comfortable. He felt so much more in control of his body and his
Mm,
balance. His knees didn't bother him. For every 1 pound you are overweight, that's about 7 pounds more weight on your knees to have to manage. So
mm,
just being a little bit overweight, caught, the arthritis and the joint pain and the chronic pain issues that come with that. Not for everybody, but for many. It makes it hard to like get into some like cardio to
yeah,
like work it
right?
off. But if you're in a gentle environment like the pool, then you're able to do a lot more without pushing yourself over the comfort zone limit there. And so he, within a year, he had like lost like somewhere between 30 and 50 pounds, I think it was that first year. His diabetes, he had been stable for a decade at at his blood level. His A1Cs were about like 7.2, and within a year we got him down to like 5.9. He started cutting his medications with his doctor, of course. So he was able to get off of a lot of medications. He wasn't needing any more pain control. He was moving. He was able to, go back to like grocery store shopping on his own, and these like activities a lot of us take for granted. Which, if you're dealing with pain, if you're not able to exercise, if you're not able to be active, a lot of life just starts like getting smaller and smaller, and your activities are getting narrower and narrower. So I just want to open that back up again for everybody,
I love
and
it.
make sure that they know that there are options, that there's always a solution for exercise. If you can find a good physical therapist to help guide you through it, we can get you, as a profession, we can get you back on the right track. And as an individual, I am very passionate about getting people back on the right track so that they can live their longest, healthiest, most fulfilling lives.
I love your enthusiasm, and it's so contagious. And if people are resonating with what you're throwing down, where can people find you online?
Well, you can go to my website, is jennifersylvesterdpt.com, or drjenpt.com, drjenpt.com.
We'll
And
have links down below too. So
awesome.
yeah,
Thank you.
that'll make it.
I've got my online fitness classes on there. And of course, the first class is free because I want you to decide if it's the right match for you. So if you let me know, I'll give you a free class. And then booking virtual appointments through the website. And as I'm touring around, I'll be able to let people know where I'm going to be if they need an in-person visit, or if they want to attend one of my events. Coming up mid-May, I'll be back in the Bay Area.
Cool.
So that's going to be my biggest set of events, is going to be from May 10th through 22nd. So I'll be having aquatic classes again there. And then some.
Where in the Bay Area too, if anyone's. Is it going to be all over, or at one specific place?
I'm centered in San Jose for this tour.
Okay.
Yeah. And cool. I'll also be heading down to Santa Cruz and the Monterey Bay after that. So
sweet.
I'm available.
Awesome. Well, I loved hearing and learning about more about aquatic therapy. I mean, the potential for someone who's struggling to move their body, it seems like the best thing in the world, like literally the best thing in the world. So I'm really, really excited to just learn more about this topic. And if anyone's out there listening, be sure to reach out to Dr. Jen. And Jen, we'll close this out by, I always try to get people's opinion, their perception, their definition of enlightenment. What does enlightenment mean to you?
Oh gosh. I don't know if anybody can ever be fully enlightened with all the aspects of life, but I think that enlightenment, for me at least, is that we're doing the best we can with the information that we have. And as we learn more, we need to do better.
Oh,
so it's a constant journey of learning and discovery, and trying to just live life a little better, with a little more open heart.
There's this, back in the day, I did some Zen monastic training, and the Zen founder, Dr. Dogen, Dr. Dogen, we'll call him, even though he did not have a medical degree. That was 1,000 years ago or 700 years ago. But one of his quotes was like, "Practice equals enlightenment," and I always really appreciated that. Like, it's like a circle. Practice equals enlightenment. They're not different. So fun little. I feel you. Cool. Well,
that's
thank
a
you
much
so
more
much.
Concise way to say it. I like it.
Sure. Thank you so much for coming on. I really enjoyed it.
It's been a pleasure. Thank you so much for inviting me.
All right. Namaste, everyone. Thank you so much for listening. It really does mean the world to me. And be sure to check out the Eating Enlightenment journaling app on iTunes and iOS. It's also available on my website at eatingenlightenment.com. But try it out. Download the app. Start today, because it's pretty simple and quick to get the hang of this really simple guideline. Journal before you eat. Journal with awareness before you eat. Write out your thoughts and feelings in the app before you eat. Do that. You will see results right away. You will start rethinking and changing your eating decisions. You won't binge as much if you write stuff down. It's that simple. I want you to try it for yourself. I want you to go to the iOS store right now while it's fresh on your mind. While it's fresh on your mind, go to the iOS store right now, download the Eating Enlightenment app or Android, or go to eatingenlightenment.com. It's right on the front page. Download the app. Give it a shot before your next meal. You can start today. You can literally start writing your thoughts and feelings out on paper, getting those neural connections established from your feeling body to your mind. You can start building those neural pathways, which are going to help you change your eating habits in a really practical way. You'll see changes right away. You will realize that the unhealthy food right in front of you you don't even want it. You realize, why am I even going towards it? Why am I grabbing towards it? You'll put it away. You'll move on with your day. You'll be more present with others because you got those thoughts out of your head. Even if they're crazy thoughts, you got them out of your head onto paper, and now you can be more present with people because your mind is more free. Oh my gosh. Okay, so I'm going on a ramble, but the point is, if you struggle with food, and let's be honest here, some of you listening do, that's okay. If you're a creative person, you like expressing yourself via the written word, right? This journaling thing isn't for everyone, but if you struggle with food and you're a creative person on one side, or you're highly organized, extremely hard worker, and logical on the other side, the journal is meant for those folks, and those folks love the journal. Highly organized people are able to finally struggle to get their feelings out on paper, but writing is something that they can do. It's natural to them. And then the organized person who's maybe more chaotic is actually able to put structure to their thoughts and feelings around food. It's just a amazing practice that can honestly change your life. That will change your life. The more you commit to this, the more you understand this. So, you know what to do, and stay tuned for the next episode coming up.